I was referred to Visions by my counselor at the New York State Commission for the Blind. I had just received a diagnosis from my doctor that my vision had deteriorated to a level where I was now considered legally blind. When I first started receiving these services, I was learning how to adapt to everything. And this is an area where the medical community leaves the patient just there. And services like these are the gap that fills in everything else. I'm able to read Braille. The simplest thing, like taking an elevator and knowing what floor I'm on, is just one of the simple tasks that without learning something like Braille, I wouldn't be able to do. Emotionally, it's been incredibly difficult. And working with people who understand that has been a lifeline. And I didn't even know I needed this lifeline because at one point I was independent and I never asked anybody for help. Before this all started, I was in sales for IT, and the world of IT, as much as you would think, is very much driven to using all the latest technology. It's also very visual. So learning how to adapt to that was something that was a challenge. And if I didn't have these wonderful people at agencies such as this, I wouldn't have been able to do any of these things. It's a process, and the one thing that you realize is your vision is on a downward slope. You don't know the speed of that slope, but as you prepare for it, preparation is the only thing that you could do to meet these challenges. And as my vision becomes worse, I'm going to be prepared for everything. One of the services that I used, for example, was the services of the orientation and mobility instructors who taught me how to use a white cane. It was one of the things I was reluctant to use because it would tell the world that I was visually impaired. And there's a sense of shame because you're not perfect. But they taught me, number one, it's important to communicate to the rest of the world what you cannot do. Otherwise, the world sees you as fully sighted. They taught me how to get through an airport. They taught me how to get through a busy New York City street. And they taught me how to get through these places safely. And more importantly, by using the cane, it allowed the world to know what limitations I was dealing with. And if I asked questions that seemed silly to other people, now they understood. In terms of daily living, there were rehabilitative specialists who helped me work in so many ways. One of the many ways that they helped me was learning how to cook again safely, how to understand where things could be better organized, and how to make sure that I didn't cut a finger. If I broke glass, which is a major challenge, and you have shards of glass all around you, how do you function? How do you deal with problems along those lines? So it's simple things, but important things. I knew I could rely on them because they were people who were trained in how to do these things. One of the things I'm able to do today that I would have never been able to do had I not received these services is I'm a volunteer at a hospital that specializes in cancer treatment. When I listen to a patient and they see me, they are inspired by the fact that not only am I a cancer survivor, but I'm able to do this work with them. They say to themselves, well, if she could do this, then what I'm facing is not insurmountable, but very much within what they can face and overcome. My children are adults and they have watched me fall in a metaphorical sense. And as they see me become more independent and less afraid and more confident, they themselves have felt so much better about every time they say goodbye to me. They know that they're leaving a human being that's not reliant on them, that is safe and in fact thriving. As I've gained these skills to adapt to my vision loss, I can see how the tension has decreased in such a great way, and their worry has in fact decreased, and our relationship has been so much better. You forget about how vision loss affects everybody around you, your family, your friends, everything, not just you. But by being a person that's thriving is a fever or a wave that everybody can catch on to, and it's a good thing.
New York State Commission for the Blind is proud to partner with Visions through the Older Blind Services, through Rehabilitation Services Administration grant. We find that older blind rehabilitation services are extremely important to maintain people's independence and participation in the community for people over the age of 55.
Vision's Services for the Blind and Visually Impaired